Hey guys, good morning. So, sorry it took me 6 to 8 hours to be able to download this lecture since need na ako mag-sleep. Okay? So, please bear with me and I hope that you learned something out from our Zoom meeting last time. And today, let's discuss the planning phase. And then afterwards, we have to discuss the implementation and then the evaluation right after. So after discussing the three phases, we have to meet again through Zoom so that I could introduce you the process from assessment to evaluation. So is that clear, guys? Oh, that's it. So now let's discuss the chapter 13 of your book, which primarily talks about the planning phase of our nursing process. So what is planning? So in your book, it's stated there that planning is the deliberative, systematic phase of the nursing process that involves decision making and problem solving. So nurse refers to the client assessment data, balik again to assessment, and diagnostic statements for directions in formulating goals and designing the intervention. So now, if you will going to look at your Nanda handbook after the defining characteristics, there are some of the projected planning, okay, written in your Nanda handbook. So you don't need to memorize, you don't need to worry kasi lisod man maghimo og planning, miss, ganyan. But the planning, the steps in planning are actually written in your Nanda handbooks para di na mo kaayo maglisod. But of course, you have to rely on your assessment and your diagnosis or nursing diagnosis. So, prior mo maka-create of planning ninyo. So, a nursing intervention naman is any treatment based upon the clinical judgment and a knowledge that a nurse performs to enhance patient or client outcomes. So when you say nursing intervention, it's not like we are relying to the physician, okay? It's like our implementation based on our judgment as a nurse. Okay, so that is why as a nurse you really have to develop your knowledge, your skills, at the same time your attitude. When you're working, it's not enough if you only have the right knowledge, okay? Yeah, wala di kay right attitude. It must go together, the KSA, yung sinasabi nilang KSA, which is knowledge, skills, and of course, attitude. So kailangan na siya mag-uban, guys, for you to be an effective and for you to provide quality care sa imong patient. So, there are types of planning. So, ma-discuss na to siya na one by one. By the way, planning is a multidisciplinary. Started from the first client contact and continues until the nurse-client relationship ends. So, kanusta man mag-end ang nurse-client relationship? Of course, when the patient was already discharged. So, dira mag-end in your relationship. But of course, we have to remind ourselves that there is actually the term na continuity of care wherein we have to give instruction to our clients to follow up to their mga RHU or sa ilang mga centers, nearest barangay, mga centers nila dito, barangay station, so that they could follow up with regards sa ilahang health condition. The first one would be initial planning. So, unsa man ang initial planning? It nurse who performs the admission assessment usually develops the initial comprehensive plan of care. So, katong usually ka ng mga nasa emergency room, since ang nurse nga naa sa emergency room, sila tong mga naka-encounter sa first condition sa patient, they are the one who first assess the patient, who gather significant information and significant data from the patient, both objective and subjective. Sila gyud ang maka-formulate og initial comprehensive plan of care. So planning should be initiated as soon after the assessment. The second one would be ongoing planning. What is ongoing planning? So nurses must obtain new information and evaluate the client responses to care. So unsa itong mga tanga example, like for example, your patient suddenly stop breathing, or shall we say ang pinaka-common is your patient suffering from seizure, and then the doctors give diazepam or somehow mga anticonvulsant medication. So of course, you have to plan and you have to evaluate if your intervention towards their client or if your planning is effective or not. Because if not, you have to do the process again. So also, of course, at the beginning of a shift, as the nurse plans to care to be given that day. Of course, kasi guys, beginning of your shift, for example, you are 7 a.m. to 3 p.m. nurse on duty, sa imong start pa lang sa imong shift, you have to divide your time, you allocate your resources, allocate your effort, your energy sa pila ka buok patient ninyo, okay? So, daily planning purposes. So, what are the purposes of planning? Why we need to plan ahead of time, okay? So, whether the client status has changed, of course, kailangan nato mag-plan. It's because to determine or to see progress with regards to client condition, if it's deteriorating ba or nagalala ba siya or it's improving, okay? It's just a matter of two, deteriorating or improving. Set priorities for the client during shift. So guys, dili tanan client nato is equal sila og time. Of course, if naatay mga patient who are suffering from airway problem or suffering from such complication, of course we have to allocate significant time for them. Like, mas maano sila, di ba? Kaya, syempre, i-monitor nato, tanaw nato is na by progress ilahang condition, if nag-deteriorate pa. To decide which problems to focus during the shift. It's like more of prioritization, okay? If you were going to take your exam, ang napansin nako is na po yung mga question na prioritization. Like, you are a new NOD, you try to begin your shift, and then there are 4 cases or there are 4 condition of your patient, which among of the patient you will going to assess first. So ganyan yung mga question. For example, a client who are suffering from difficulty of breathing. Next is first choices, for example, your client who has suffered from difficulty of breathing during blood transfusion. Next, your client who is whining or, for example, complaining about the doctor's attitude. The third one is the client who is off for surgery. Ganyan yung mga choices. So, of course, you prioritize the airway problem. The client who is suffering from difficulty breathing. So, katog ito imong unahon. Usually, ganun yung mga trends sa question sa board exam. You have to prioritize which client would you like to assess first. Kasi dili man, you cannot give your time equally to them, or you cannot assess them most simultaneously, right? So you have to set priorities and to decide what problems that you want to focus first. Okay? And the next one is to coordinate the nurse activities. Now, the third one would be discharge planning. We have ongoing and we have initial, ongoing, and discharge planning. So, it's the process of anticipating the planning for needs after discharge. Of course, kada mga follow-up. Usually, when we discharge our client, we usually give information kung asa sila magtawag if in case na yung mga emergency problem, asa sila mag-consult if there are mga untoward events, like there are significant deterioration sa ilang condition. So, we give information. So, okay, we give information or we give instruction regarding to patient diet at home. So, ganyan. So, effective discharge planning begins at first client contact, involves comprehensive and ongoing assessment to obtain information about the client ongoing needs. So, continuity of care that I was mentioning a while ago must be coordinated by the discharging nurse. Okay, developing nursing care plans. Okay, it is the end product of planning phase of the nursing process is a formal or informal plan of care. So now let's differentiate what is formal and what is informal nursing care plan, and what are the differences between the two, and is it really matters or what. So informal nursing care plan, is a strategy for action that exists in the nurse's mind. So for example, Miss Santos is tired, so the nurse will need to reinforce the teaching after the rest. Pero nandun lang sa kumbaga wala siya sa process. You saw the patient, she is definitely tired for something, like kikapo siya, and then you will really need to reinforce teaching after the rest. Mag-initiate ka na lang na unya na lang kung mag-health teaching after makapahuli ang patient. Like for example, you're about to give health instructions sa imong client, and then you notice nga tulog ka siya because that's the middle of the night. Kung hindi naman siya emergency, you can actually not shall I say cancel, what is the proper term for that, delayed for a while to let your patient rest. That's informal nursing care plan. Now let's talk about a formal nursing care plan. Is a written or computerized guide that organizes client information, where the advantage of this type of plan is continuity of care is achieved. So informal NCP usually is a written one, okay? So there is standardized care plan, is a formal plan that specifies the nursing care for a certain group of clients with the same common needs. So, mao nang standardized, which is you are dealing with patients who are suffering from hypertension, like 3 to 4 patients with hypertension. That's standardized care. So, pareha sila, you're dealing with the same condition, like you're paying 5 to 8 patients who are suffering from myocardial infarction, or shall I say 5 to 6 clients who are suffering from infection. So ganyan, so it's like standardized care plan. Individualized care plan naman is tailored to meet the client's specific needs. So from the word individualized, that would directly give you an idea. It's like tailoring the client's specific needs. So kung, di ba, even though, kasi naman talaga, normally speaking, although your patient has the same condition, but they have specific needs. Each of your client has its own specific needs. So you really have to dig deeper and try to tailor their individual needs. So they are not addressed in the standardized nursing care plan. So di man siya ma-address sa standardized is because equally lang. You're just spacing to the client's condition. So here says here that in planning phase, nurse must identify client problem that can be addressed by standardized, individualized, and routine care. So mao na imong hati-hati kani mga routine care, like bathing, for example, bathing the newborn, giving medication, that's routine care, okay? Now, there are standardized approaches for care planning. So, what are the purposes? Of course, to ensure that minimally acceptable criteria are met, promote efficient use of the nurse time. Of course, kung wala man kay appropriate planning, how can you allocate your time to your patient? Like, for example, when you are exposed, or when you're working in a public hospital wherein ang census nimo is 1 nurse equal to 60 patient or more than 60. Whereas is 1 is to 100. So how can you allocate time for them, di ba? Alam mo, isa lang imong lawas na kay 100 patient, and then you are carrying doctor's order, you give medication, you followed up laboratories result, you do everything, and then di na gini mo sila makaya, okay? That's why planning is very important. Kasi pag mag-work mo, work mo sa hospital, if you are just a novice, ang imo dyan i-work out first is imuhang time management. So, dira dyan magka-problema pag bag-uhon ka sa time management. But along the way, you can actually you will learn how to manage your time efficiently and effectively. So, it describes nursing action that are achievable rather than ideal nursing care. Okay? When we say standardized, it's more on achievable rather than talking about ideal. Okay? When we say achievable, when standardized is achievable, but individualized is ideal. Okay? Pre-developed guides for nursing care of a client who has need that arises frequently in the nursing unit. So, bali ang standardized nursing care plan kasi, pre-develop na siya. Kumbaga, may format na tayong gina-follow. So, usually, maunang nagkahitabo sa inyong station. Excuse me, wait. Next would be, what is protocol? So, protocols are pre-developed to indicate the action commonly required for a particular group. Example, a hospital has this protocol that all clients who are receiving epidural anesthesia must be placed in intensive care unit. So every institution has its own different protocols, okay? Na ay hospital nga pag mag-epidural ka anesthesia, you have to be admitted in the ICU first. But there are also institutions somewhere here in the Philippines na dili okay lang siya sa normal ward. So that is why when you are working in a hospital, especially working ka, jump ka sa every hospital sa Pilipinas, you really have to make sure that you rely to the protocols per institution. Kasi iba yung protocol sa institution mo dati, iba din yung ngayon. Okay? So policies and procedures are developed to govern the handling of frequently occurring situation. So example, hospital may implement one patient, one watcher policy. That's considered is actually a policy or a procedure of the hospital. Okay, now, don't forget this word, standing order. Okay, miss, what is standing order? Standing order is a written document about policies, rules, regulation, or orders regarding client care. So it gives nurses the authority to carry out specific action or medication under special circumstance. Kasi guys, there are doctors, especially patients who is actually suffering from hypertension. Like for example, as a patient who is na previous seizure condition. So usually ang doctor mag-order na sila tinatawag natin na standing order. For example, may give captopril 25 mg. Captopril is an anti-hypertensive medication for BP greater than 160 to 100, 160 over 100. So for example, middle of the night, your nursing attendant reported to you na ang imuhang patient BP is 170 to 1 over 110. So initially, if you check the doctor's order and you see na naa siya standing order na may give captopril, you can you give the medication, guys, ha. Do not disturb the doctor kasi may standing order siya. But of course, lahi-lahi po sa mga doctor. So usually ganyan nangyayari. But of course, after giving the medication, usually 30 minutes, you let the medication absorb in the body. And after 30 minutes, you have to reassess the blood pressure again. And if dili ko siya magbaba, that's the time that you refer it to the doctor. Okay? So, the standardized nursing care plan is the common planning in the nursing unit. Actually, guys, I'm having hard time kasi it's very difficult for me to download my slides or my presentation in YouTube pag sobra siya kataas. That's why I'm looking here the time na na-consume na to sa atong lecture. Gusto kaya siya diba? The formats for nursing care plan. So, all the formats differ from agency per agency. Care plan is organized into 4 sections. So, problem, nursing diagnosis. We already done discussing this through Zoom. So, I hope that you learn something from it. And if you have some confusion, you can message your classmate. You can message those classmates na naka-attend sa Zoom. You seek help from them. Or if dili good mo kasabot, you can message me so that I could elaborate it more. But don't worry, we can recall that one through our next Zoom meeting. Okay? So, goals, desired outcomes, nursing intervention, and evaluation. Student care plans, okay? Learning activities, student nurses must not come up with lengthy and detailed healthcare plans. So, they may also modify the plan implementation by writing rationale. So, may what is rationale? Usually, guys, kasi pag implementation na, for example, magsabi ka sa nag-fever imong patient, and then sa imong implementation niya, sabi mo doon, you provide tepid sponge bath to my client. So, ang butang nimo sa baba, rationale, of course, to provide comfort or to decrease the body temperature into normal. So that is rationale. So rationale is the evidence-based principle given as the reason for selecting a particular nursing intervention. So example, here, implementation to instruct the patient to increase fluid intake because you've noticed nga parang na-secretion ng patient. So what is your rationale? To facilitate clearance of mucus secretion. So this is like the format when you are doing your implementation. Okay? So I just have to pause it for a while. I have to check it. Okay, let's continue. Here is a sample. So, mo niya ako gin-refer sa inyo, ha. Ang inyong nursing care plan, divide na siya, kulang pa na siya o kanang duha ka, ang sabi tawag ana, box. Kasi assessment, your diagnosis, so it's diagnosis, sorry for the typo, error, and then planning, then the fourth box would be implementation, and then evaluation. So, dito ta mag-focus from assessment to planning. Subjective, dahil dagang plema man pag mag-ubo ko, maulisod po iginawa as verbalized by the patient. Your objective here is, there is a presence of phlegm, and the respiratory rate is 28 cpm. And know that the normal respiratory rate for adult is 16 to 20 cycles per minute. So it's more than 20, so it's considered abnormal. So your possible diagnosis for that, based on the assessment you've gathered, is ineffective ineffective airway clearance related to clogged mucous secretion as manifested by the increase of the respiratory rate of mga 28 cpm. Okay? Manifested because I am using the objective sign. Okay? Sa planning naman nimo within my 8 hours of shift, ganito yung format, guys. So don't forget it. Write it down sa inyong notebook so that you can actually recall this lecture every time you want. So within my 8 hours of shift, my patient will be able to, so this is your connecting word, okay? Will be able to manifest decrease mucous secretion, maintain normal range of respiratory rate. So that's your planning. That was also based on your subjective. But of course, you don't need to worry, as what I've said a while ago, because your planning is actually written, your planning steps are actually written in your NANDA. You just have to rely based on your diagnosis. Okay? Gets ninyo? Because I don't need to reiterate all over again because I've already discussed it through our Zoom meeting. Okay? Now, what is computerized care plans? So, computerized care plans are being used to create and store nursing care plans. So, for individualized nursing care plan, the nurse chooses the appropriate diagnosis from a menu suggested by the computer. Okay, there is what also we call multidisciplinary, or such thing that we call collaborative care plans. Kasi collaborative is a standardized plan that outlines the care required for client with predictable or usually medical conditions. So it includes medical treatments, which is primarily belongs to the doctor's job description, to be performed by other healthcare providers as well. For example, your doctor's order na referred to ortho for further management. You refer to respiratory therapist for further management. Of course, as a nurse, you have to provide collaborative care plans. So you refer it to respite tech and so forth. Okay? Now, what are the guidelines for nursing care plans? So the first one would be date and sign the plan, and then use the categories of headings like such thing that we called ADPI. So, yun nyo baliktara, guys, ha. Dili mag-una ang implementation kay sa planning. Dili mauna ang diagnosis sa planning. So, it should be ADPI. Putang na sa inyong utok. ADPI, it's assessment, diagnosis, planning, implementation, and evaluation. So, use the standardized approved symbols and, do not use your own abbreviation. So, dili ka pwede maghimog own symbol nimo. So, for example, the best example here is turn the client in side by side Q2. It's a perfect abbreviation kasi approved na siya kaning Q2, Q4, Q6, Q8, Q12. So, ganan. So, be specific if it is 8 or 12 hours of shift. That is why here in our example, kung 8 hours lang mong shift, you have to be specific. Within my 8 hours of shift, if your shift is 12 hours, within my 12 hours of shift, so just be specific, guys, okay? And refers to the procedure books and other sources of information. So, you tailor the plan to the unique characteristic and needs of the clients based on the assessment that you've gathered. You ensure that the nursing care plan incorporates preventive, okay, maintenance aspect, as well as restorative care. So, imong implementation, you have to make sure nga na-cater niyo ang preventive, maintenance, and restorative. Ensure that the plan contains ongoing assessment of the client. Of course, you inspect client wound or surgical site Q2. Okay? You inspect client condition Q4. You monitor client while on blood transfusion every 2 hours. So, ganyan. You also include collaborative and coordination activities in the plan of care. Like you presented or you wrote in your nursing care plan, sabi mo doon na nasa imong, for example, na ay mga secretion, imong patient na ay mga phlegm nga na-trap. So, you give medication or yung mucolytic medication as ordered by the physician. So that is your collaborative intervention. So it includes plan for the client's discharge. So sabihin mo doon, proper discharge activities are being given or being taught to your clients. So ganun yung sabihin mo during your implementation. But you just have to make sure that this is all covered. Okay. For planning process, okay, the first one you set priority, sabi ko sa inyo, is just a matter of prioritization. Okay, prioritization is the process of establishing preferential sequence for addressing the nursing diagnosis and intervention. So, unahon ba nimo tong nagpangit og ka ng naglisod og ginhawa kasi naka-blood transfusion? Of course, you have to follow and always remember, ang atwa is EBC. Okay? Airway, breathing, circulation. So, unahon gini mo ng airway. Kung nag-suffer o ka ng lisod ginhawa, naka-blood transfusion, naay pasyente nimo nga kailangan nimo i-prepare kasi padulong siya OR for a surgery. Naay mo client nga sigreklamo, naay client nimo sighilak because sakit iyang dextrose. Of course, unsa man jud pinakaunahon nimo? Of course, the airway. You choose first the client who is suffering from airway problem, katong nag-react sa blood transfusion. So that's what I'm telling you guys. So what needs require first attention and what is second, third? As far as I remember, when I took my NCLEX, most of the questions being thrown to me are more on prioritization. Unsay mo unahon, unsay mong iwahi, arrange nimo na siya, what is the lowest to highest, what is highest to lowest. That is why as early as now, I want to introduce to you how to prioritize patient or how you prioritize things. Okay? Nurses use Maslow hierarchy of needs when prioritizing. Example, nutrition. Nutrition, mao ni imong mga diagnoses. Nutrition, malnutrition, less than body requirements. Breathing, inefficient airway clearance. Poor ventilation is your disturbed sleep pattern. And lack of support system is poor relationship. Of course, you have to select first the breathing. Okay, next would be malnutrition. Okay. And then next would be your safety. Poor ventilation, okay, and then lack of support, which is the love and belongingness. So, ikaw. So, that's how you arrange based on your nursing diagnosis. I hope you guys na makafollow mo sa lecture today and make sure that you really allocate time to watch the lecture. Next would be priorities change as the client response problems and therapies change. Of course, dili always kasi kung mag-respond yung patient nga na airway problem, of course, dili man mo na siya permanentihon o prioritize. So, proceed ka na po sa another patient who primarily needs your utmost care. Well, here are the following factors that a nurse must consider when assigning priorities. Of course, client's health values and beliefs, client's priorities, your resources available sa imong unit, urgency of the health problem, and the medical treatment plan. Okay. Next would be you establish client goals and desired outcomes. So how can you establish? So after establishing priorities, the nurse and client set goals for each nursing diagnosis. So what is goals or desired outcomes? It is described in terms of observable client responses, what the nurse hopes to achieve by implementing the nursing intervention. So expected outcome criterion or objective, okay? Your goal here is broad, okay? Medyo broad siya. Improve nutritional status. Okay, mao na ang kalahian sa goal. Your client will manifest or improve nutritional status. But, if your desired outcome should be is a specific ones. Kung ang goal is broad, ang desired outcomes naman in contrast is a specific one. Like ibutang nimo dito within my 7 days of duty, my patient will be able to gain 5 pounds of weight, ganon. So you have specific criteria or you have specific measurement for that. And there is what we call short-term and long-term goals, okay? Short-term goal might be, for example, client will raise right arm to shoulder height by Friday. And we say long-term goal naman, it might be client will regain full use of right arm after 6 weeks. So it's self-explanatory. Even if you will just read the statement, you can automatically understand the difference between the two. Okay, here are the components of goal or desired outcome statements. The first here is subject, okay? Clients. Mao na siya. For example, within my client's 8-hour shift, my client will be able to. And then the verb will be measures. Okay? Will, for example, will measure more than 2 pounds or have a gain weight of 2 pounds. Then condition modifiers is such thing that we call less than 25 centimeter, 45 liters, ganon. Ito verb kasi ito is subject. Criterion or desired outcomes within a day, within 48 hours of time. So this is the components of goal or desired outcome statement. So I tried to make this diagram so that it's easy for you guys to understand the pattern. Okay, subject, verb, conditions or modifiers, and criterion or desired outcomes. So how can you formulate guidelines for writing desired outcomes? You have to write goals and outcomes in terms of a client responses, not nursing activities. For example, the correct statement would be the client will drink 100 ml per hour. Ganyan. And the incorrect one would be maintain client hydration. So, you don't need to do that. You have to base your goal and outcomes sa imuhang client responses, not on your nursing activities. So, you have to rely on this example. Be sure that the desired outcomes are realistic for clients' capabilities and limitations. Dili po ka mag-ingon ka na after my 8 hours of shift, my patient will be able to walk freely and without any pain. Pero imong client is bago lang siya na post-op surgery. So it's unrealistic kaayo. Remember, when you're setting your goals, you have to be smart. Specific, it should be specific, measurable, attainable, realistic, and time-bounded. So don't forget the smart. Okay? Be sure that desired outcomes are realistic. So, balik-balik na ko. So, measure insulin accurately is unrealistic for client with poor vision. So, okay. Next would be ensure that the goals and outcomes are compatible with the therapies of other professionals. For example, the client will increase the time spent out of bed 15 minutes a day is incompatible if the doctor ordered for bed rest. So make sure nga before po ka mag-explain po og ka ng certain instruction or health teaching sa imuhang client, it should correspond to the doctor's order. Di nag-ingon day preterm labor di imong pasyente, baka kabalubot-buot ka dito ma'am pag-ambulate kasi nakakita ka sa kanya na buntis. But of course, you have to rely on to check the doctor's order if permitted ba siya mag-ambulate. Make sure also that each goal is derived from only one nursing diagnosis. Okay, you cannot formulate 2 nursing diagnoses at one time, okay? 1 nursing diagnosis per nursing care plan. For example, imbalanced nutrition, less than body requirements. So, all intervention and planning must be related to diagnosis. So, dili ka pwede kay ang imuhang nursing diagnosis ka imbalanced nutrition, less than body requirements, imuhang planning and implementation dili about nutrition, which is actually wrong, okay? Use observable and measurable terms for outcomes and make sure the client considers the goals or desired outcomes important and values them. Okay? So how can you select nursing intervention and activities? So there are types of nursing intervention. Okay, independent intervention are those activities that a nurse is licensed to initiate on the basis of their knowledge and skills. For example, physical care, physical care, ongoing assessment, emotional support, comfort, teaching, counseling, environmental management, making referrals to other healthcare team are considered as independent interventions. Example also is diagnosis, impaired oral mucous membrane. So that's nursing intervention. So the independent would be perform oral care. So you don't need doctor's order to perform oral care unless there is some complications sa patient nga kinahanglan nimo mag-rely sa doctors. Okay? Dependent interventions are activities that are carried out under the orders or supervision of a licensed physician or other healthcare providers. So, it includes administering medication. So, dili ka pwede makabot-bot o hatag og meds without even consulting the physician. Katong ingon ako sa inyo ganina na standing order, you can give that medication for once only. So, only once ka lang talaga magbigay. Pag after 30 minutes, after doing reassessment, you've noticed na hindi nag-lower down yung blood pressure niya. Now, you have to refer it back to the doctor so that the other medication should be given. So, naghatag naman ko og standing order, di na ako na-refer kay doc. No, you are liable and you're responsible to do the referral. Kasi pag hindi siya nag-change, hindi nag-improve yung condition ng patient, you have to rely or refer it back to the doctor. And even ambulation order, usually doctors na mag-order naman sila ambulation na. You let the client ambulate. So, ganyan. Next would be collaborative interventions or actions that the nurse carries out in collaboration with other healthcare workers such as physical therapies, katong mga patient na to are suffering from vehicular accident, na sila mga fracture or what, so they required physical therapies, and then that's the time ginatawag siya collaborative. You referred it to social workers and dietitians. So ganyan yung collaborative. So actually guys, there is a part 2 of this lecture, so I tried to cut it to 26 out of 26 slides. It's because sabi ko nga sa inyo, it's difficult for me to download it in YouTube if super kataas na akong lecture. So you have to cut it and you have to wait for the next part of this lecture. Like I think 10 to 12 slides remaining. And then we have to proceed to our implementation evaluation phase. Okay, so make sure that you've watched this lecture because this would give you an insight. This would give you information and basic information about what is and what are those planning about, or what are those setting goals and outcomes on saba na siya ng mga terms. So you really have to encourage each other to watch the lecture every now and then. Okay, I know some of you maybe have experience already or have knowledge already about these topics, but it's better for you to maghatag mo mga additional info sa inyong sarili. Okay, that would be all for today, guys, and I hope that you learned something karon sa ato ang lecture. Thank you guys for listening and have a good day.